dialogue. And with that, I'm so happy to move on and bring Mr. William Carter, to the stage. Will, the
Thank you.
stage is yours.
Thank you very much. It's an honor here to be among so many bright people who have knowledges and learn something. And sitting here, listen to everyone. I think I'm going to start at the end of what I wanted to say with my story. One of the reasons why I'm here is to bring that true community engagement to this table here and the importance and the value of people who um, proper term is live with HIV. Well, it exists with me. I don't live with HIV. It exists with me, and that's my own personal opinion for myself. It works for me. The other thing is that we truly value what's going on and being open minded to listen to those of us who are not college educated but are aware of their status and what they're doing. And with that, I'll start from my beginning with a couple things that I prepared. I turned my adversities and disabilities into possibilities. I am a multiracial man who identifies with being African American, but I do realize that I have three other nationalities in me, and I have a value with that too. I have been living with HIV for now 22 years, and this is what the face of HIV looks like at 56. I am the father, adoptive father of two sons, seven grandchildren, and I am one of the first gay men adoptive parents in the state of Pennsylvania to win National Adoptive Father of the Year. About that was in 2001. I won that award, and I have personally assisted 22 gay men to become parents and are still flourishing. And I am also another person of disabilities. I'm an amputee. I am a former 385-pound man. 6 years ago, proud this week that I've kept my weight off and managed it. And I was legally blind for 2.5 years. So you name it, I've been through it. I've had 53 operations before choosing to have my leg amputated. But as I said, I have turned my disabilities and adversities around to possibilities. I now am the co-chair of the BEAT, the Martin Delaney Collaboratory, and have been for the past year now. I am also sit on Babashi's board pretty much since the inception of their, not their board, I'm sorry, their CAB. And they are the longest running community service agency dealing with people of color and all nationalities and also offer social services in the city of Philadelphia. I help run a group with Philadelphia Fight and our our co-chair, well, not my co-chair, but the chair of the Beat, Stephen Johnson, a group called Positive Man. And what that is a men's group for those males who identify being heterosexual. And it's not what others see them as heterosexual, what you see yourself as. As long as you identify with being a heterosexual man, that is what is welcome in our group. And I'm very, very proud of that. And it's a very open forum dealing with that. And I have been doing that for a while. And been I've been blessed to have the opportunity since sitting on the big cab to being afforded to work for the University of Pennsylvania now in one of their mental health departments. We're dealing with people living and surviving with HIV called the TIDE study. And what I do is I help match people with HIV with with this mental health service, which is very, very important that not only do we treat people with the virus, but deal with that mental health because from the beginning, that is the first thing that slaps you when you receive that diagnosis of being positive. There's no way around it. We all have, those of us who are positive, we all have been, every last one of us have had some point of depression. But dealing with that with this tide study has allowed me to heal. And I am currently participating with the BEAT Martin Delaney Collaboratory, the PEGIFN study, which is an interferon study, which I have been on now for the past, I think it's about 8 weeks now. I think this week or either next week will be 8 weeks. And I have been off of my antiviral medicines now for about 7 weeks total. And what that is mentally and physically, what that does for me is allows me to, one, have clarity. I feel like I was in my 30s before I was diagnosed with having HIV. I have so much more energy. I sleep very well. I also, it's a big boost when you don't have to wake up and pop a pill by a certain time. I have been on my meds now for about 17 years, and I say I've missed 2 months of medication, even though I technically have not, but I haven't missed a dose since I've been on my meds. I go for my weekly injection. I'm in there the same time every week, and I go out, and then once a month, I go for my infusion. It is the most pleasant feeling and experience not to have to take a pill. That does wonders for you. Just to find out that you're doing well. And some of the benefits of this is one, I have excellent, excellent, excellent medical care. Tests that I knew I had to take this year, they've already been done because of the study. My primary care physician, my infectious disease doctor, and I'm even going to throw in my case managers, all are quite aware of what's going on with William. They get weekly updates. And you know, for those of us who do have case management, they want their labs every 3 months. Well, they don't have to ask that for me. It's been a benefit for me that if I hadn't missed going to the doctors, they would already have my labs. So they get weekly reports on my weight, my height, because I do suffer with weight issues now. And so, and I, it's a wonderful thing having care right there. Recently, I went to the doctors and he was getting on me, told me I was being non-compliant, didn't give him any labs. So I asked him, well, if you open up my chart or pull it up in the computer, you have all my labs right there. I get them done weekly. So you have them. And it's been a blessing. And from that blessing, that I was able to speak to the other 9 doctors in the practice because they hadn't heard of the study. But the fact that they had a person who was there actively participating and them knowing that where I was a few years ago when I was wheelchair bound, couldn't move, that I'm walking into the clinic to see my doctor and able to speak with them on a level that which I was not able to do is a wonderful, wonderful opportunity. And that's why I say having your physicians speak to the patient, look them in the eye, don't look to their left, don't look to their right. Look at them, see who I am, see my needs, listen to me, because You may know a little bit more how it works, but I allow it to live with me. And I do say allow HIV to live with me because I do have a choice. It's a negative choice, but I don't want that. I was told when I was diagnosed by a very good friend of mine, you have two choices. Either you're going to live with HIV or you're going to die with it. So you have to choose, and you have to choose wisely what's the best decision for you, not anyone else. I was asked why did I join the study? One, because I was co-chair of the BEAT. Well, I am co-chair of the BEAT. Two, I had a lot more knowledge of it. And I sat there and I thought, I'm a recruiter now, getting people to do studies. Why aren't I putting my money where my mouth is? If I'm asking people to do this and I say I believe in the study, I didn't actually only did it because I didn't think I was going to qualify for it because of the restrictions that they have. But lo and behold, I qualified for the study. And it makes it so much more powerful to hear the things and some of the implementations of the way procedures are done. I had to say so in that at that board meetings and going to different sub meetings with that. So community engagement, once again, you're going to hear it a lot from me, is major. It is because of that. And then I had a period of time where I was going to drop out at the loss when Timothy Brown died. I was in a bad place that really threw me for a loop. I did not know him personally, but I was aware of his story. And then my family member, my sister, who I'm extremely close with me, she said, how dare I be a hypocrite? You ask other people to put yourself in jeopardy. What's wrong with you? Why are you so much better than them? So, because of my sister and my colleague on this phone here, Steve, I sit as a member of that study because I think of the people who came before me who were taking 25, 30 pills 2 and 3 times a day. I was taking my Triumeq once a day and was happy. But because of me, I'm making history. I'm making plans for my grandchildren to see their papa survive and thrive. That's a wonderful thing. That's a legacy that I can pass down that everybody's not able to do. It's not that they don't want to do it. It's not that anyone who's unable to participate in a study can do. That's not for everyone. But our mission is to, when we speak to the people that we work with or our patients of yours, is to speak to them and have them bring up the conversation about HIV, because if we do that, it tears down the stigmatism all the way down. It should be open. I didn't tell anyone I was positive. I didn't even tell myself my first 10 years because I wouldn't take my medicine. So if you don't tell yourself and be honest with you can't be honest with anyone else at all. So, but if we do that, it just you know, warrants the taking down the demystifying of researchers, studies. We all know studies have a negative impact on it, and especially on my community that I identify with, which is two at this one particular point, which is the gay community and also the African American Museum because of previous things. But if you don't talk about it and say that you are a person who's doing that, and I can say for the beat, our PIs are willing, and I've asked them to come speak to several different groups. And guess what? They came. So just seeing the head honchos when they come to the support groups with people living with it just knocks their socks off that they came there and they talked with them and not at them. Makes a big, big difference. I'm very proud of of the being on there. It makes me want to do more. And I do a lot more than I know that I don't do. And as far as the study itself, the interference study that I'm on, you could not ask for a better group of people to come into a place who, as we know, we're all busy. But if I have a 9 o'clock appointment, I have, at the latest I've ever waited was 5 after 9. It's not a lot of people in the practice. It may be one or two people in the office. And no one knows why you're there. So they look out for that because people don't want to be identified of saying that they have HIV or they have AIDS. You don't know why they're there. And especially during COVID, that's not an issue. We've come up with ways of getting there. I use our local transportation company to get me to and from my appointments. And because I tell them that my system is compromised, I don't ride a van with a bunch of people. I ride and lift by myself to and from my appointments. And if you do that and speak up and advocate for yourself, it's wonderful. Every time I go to my appointments, even if it's just for my 15-minute injection, we go over that consent form. I know why I'm there, why I still want to be there, and I know exactly what is being done. So the fact that I know that and I can see as advisory board member that some of those rules I helped come up with. Do you know what that does to a person's ego that who had self-esteem problems at one time? That they can say, "Well, I helped write that. I helped with that," and to see it being put into practice, it's a great thing. The equipment and everything is top notch. Everything is clean. Even though I've been going for almost 8 weeks, I still get told the same thing over and over about the IV, about the needle, how much I'm getting, why I'm getting it, how long it's going to be. And it's not a bad experience. I have the choice of being laid to lay down or to sit up. But usually I'm at work when I go for my treatments. So I've been fortunate and blessed enough to be able to share that with other cab members seeing me get a treatment. That it makes it a lot easier if they see what's going on there. And I just want people to really appreciate the things that you all do and remind yourself why you're doing what you do. And if you feel as though that you're not doing or have that same level of confidence when you first started, you might need to step off for a hot second and then come back to get that find that fire or speak up and ask for help, as all of us had to do. And I still remain 8 weeks later undetectable. My viral load is great. I couldn't ask for anything anything better. And just to have people to see me and not through me, because as I said earlier, I am allowed HIV to live with me. And this is what the face of HIV looks like when you do take your medicine. You have your entire life. So I'm open to any questions that anybody may have. And I do truly thank each one of you for listening to me.
Yes, thank you, William. That's a beautiful story. You're a beautiful spokesmodel. One of the questions that someone has asked, do you know whether you or the study team has attributed your resurgence of energy? Do you think that's because you are off ART, or is it because of the interferon? Do you know? Have you discussed that with the study team at all?
I have talked about it slightly, but I think it's a place where I'm at in my life, being an active person with HIV, being more aware. And I can say now in my life today that I'm not content with life. I'm actually happy. I love doing what I'm doing. I love taking the not taking my medicine, but I truly can say that I prior to taking the interferon and with the other two antibodies that I don't know that they give me as a drip. I don't know what they are,
Mhm.
but I feel like I was in my 30s, my early 30s.
Mhm.
I'm back to riding a bike. I can roller skate again.
Wow.
I I I actually model prosthetic legs for the University of Penn. I have my life back, and not being regimented to taking that pill by 8:30 every morning because I gave myself that half-hour window. I'm free to do whatever I choose to be and to live my life and not exist.
Mm.
So I think just the positive energy and the hope that maybe one day, as Lori said, that I may only have to go get an injection once or twice a year or take a pill. That's a possibility that makes me feel good. I can't say that happens for everyone, but it does for me. And I can tell you this, when I do get my interferon injection, I get two very, very, very good nights of sleep. I sleep like I just came from out of the hyperbaric chambers like I did years ago. I sleep solid and through the entire night. So psychologically, I think it may do, but they haven't told me if that's part of the effect or not. I'm attributing to it because I didn't feel like this prior to the study.
Mm. Wow. And are you concerned about restarting your HIV meds?
No, because I trust the people that I'm doing this with and I'm doing it for. I know that there's a risk because I'm reminded of it at each and every weekly visit,
Mm.
and also just being aware of my status that way. So concern for me, it's low. I know it's a possibility. I knew that even as being a gay male, that HIV was something that I could have, but I don't want to live on what I could have. I don't want to exist. Like I said, I'm living my life.
Mm. Mm. Well, thank you for sharing this part of your life. I think it's a testament to your own personal character that you are following the legacy of Timothy Ray Brown, who is probably the biggest example of someone who's come out as a research participant when they didn't need to, and represented and sort of modeled that behavior for others. And you're picking up that lineage very well, and I really admire that in you. I wanted to bring in some of your other Beat HIV cab members now, because I know we have some research that was done there in Philly that we want to talk about with the perspectives that people who attend the HIV clinic there in Philly have about cure research. So thank you, William, for joining us.